Hi, I'm Carnevale with CARESTREAM Health, and joining me right now is Mark Straub, who is the PACS administrator with West Allegheny Health System.
Correct.
And Mark, can you tell us a little bit about your facility?
Sure. West Allegheny Health System is a system of 5 hospitals, 2 city hospitals and 3 community hospitals. Total, we have a radiology volume of about 700,000 procedures annually.
That's great. That's
Yep.
great. Now, when you come to a show like RSNA, you're certainly presented with unlimited choice and the PACS systems that you can evaluate and look at.
Right.
What's your advice for other PACS administrators? How do you evaluate the different PACS systems you're seeing at the show?
Yeah, I think the thing you need to do beforehand is understand your requirements that you need in the PACS. To come to the show and just look at PACS randomly doesn't make a lot of sense because they all do different things. So what we did was we sat down and had a discussion, like what are our requirements that we need a PACS to do for us.
So it narrows your field a little.
Exactly. And again, you know, we're an academic facility, so that adds something to it. We're a multi-hospital facility. So it's, you know, that automatically may eliminate some vendors' applications, things like that.
Great. Now, at RSNA, it's always the newest, most innovative thing.
Right.
What are some of the things that are on your radar this year in terms of PACS?
A few things. One is we're looking for a zero footprint client for image distribution and actually for diagnostic workstations also. I know that's a little premature maybe, but it's one of the things we need. A couple other things are critical results, peer review, and some things that are typically outside of the PACS system that we need to use.
Now, your facility made the move to CARESTREAM Vue in 2009.
Correct.
Can you talk about what drove the decision to use that technology?
Yeah, what we had was in 2005 we had separate PACS systems in all 5 of our hospitals. And the reason at that time is even though we were a health system, they were independent hospitals with independent and different radiologist groups. So at that time there was no need for a global work list or things like that. Well, that's all changed. We're now actually starting to work as a health system, and a single radiologist group is starting to work at all those hospitals. So they had to have the ability to read studies from any of the hospitals in a single work list. The other component is we do a lot of subspecialty reading. So we needed to be able to break it down into musculoskeletal and neuro and spine and things like that. So that was really the driving factor.
Has the feedback been positive from the different specialties in the use of this technology? Have they seen productivity improve?
Absolutely. Productivity is one part of it, but the efficient use of having manpower where you need it is the bigger thing. You know, so we don't have to duplicate the number of radiologists at each site. We can have what we need there, knowing that a radiologist at one site can cover 3 or 4 sites at a subspecialty level. So it works very well. Absolutely. Yeah. They are much more productive because they can, on two levels. They're more productive in total number of exams reading, but they're also more productive in stat cases, ER cases, things like that. They're able to get to those faster.
Great. Well, we wish you an exciting show. We have a lot to look at, and I want to thank you for your time. So thank you.
You're very welcome.
Great.